Now we would like to move to the panel discussion, and I'll try to stimulate the discussion with a few pointers. If I would like to talk about our first theme, which is access to care, I would like to ask Dr. Eliana Arias, the Department of Health and Human Services in the United States Healthy People 2020 initiative emphasizes health equity and easy access to care, which was also one of the very important missions that we have in our 10-year plan. What can we learn from the U.S. experience for this initiative?
Thank you very much for the question, and good morning to all. And on behalf of the President, the Secretary, and even the Director of CDC, I'd like to welcome you to Atlanta, and thank you for involving us in this event and the partnership that we have developed over time. The current situation in the United States actually has offered incredible opportunities for the government, our government, to address health in a way that we've never been able to before. So we started the tradition of identifying targets that we wanted to meet in the United States, and we have devoted significant, and we have committed ourselves to making sure that we make the progress that we need to in those areas. Traditionally, the response to that has been through healthcare, through the delivery of services and making sure that we make those services available. We continue to do that. But the other thing that has happened more recently is that in addition to the delivery of services, in order to address the conditions that are targeted in Healthy People 2010 and then now 2020, is also the emphasis on prevention. In that one of the things that we want to do is make sure that we prevent as many cases that are going to need delivery of services as much as possible. At the CDC, we do that because essentially that's our mandate, that's what we do. But the other reason for doing it is that we know that if we're able to prevent those conditions, we reduce the need for services, and the high costs that we saw earlier essentially get reduced, either because of the reduction in healthcare costs that are incurred when actually there are situations that develop, but then the other is through the saving in productivity costs for the private sector as a result of individuals who develop chronic conditions or who have to care for an individual in their family that develops a chronic condition. So one of the things that a major strategy that we then are following here is not only increasing access to care, which is critical, and we're committed to that, but then also increasing access to prevention and making sure that we create contexts that touch upon everybody across the board to reduce those disparities in the same way that we're trying to reduce disparities by increasing access to care.
Thank you very much. Would you like to touch upon what would be the strengths in the CDC system that we can adopt in Saudi Arabia?
I think one of the things that we have learned is critical for our success is recognizing that as a government agency, as a federal agency, we are not the ones who primarily are responsible or in control of being successful at that prevention. The partnerships are very significant. We have been very careful to identify what are all the sectors that actually touch upon the lives of individuals who we are trying to improve. What is their role in that prevention and making sure that we partner with them? Business is critical in that for two reasons. One is you have individuals who actually are being influenced by contextual variables in your workplaces that can be influenced in order to prevent situations. The other is you can also provide information that allows them to make healthy choices either for themselves or their families. So that the partnership with business then is critical, not only again for the delivery of information that is helpful in prevention and in dealing with the prevention of chronic conditions, but also in actually implementing programs that are going to be cost saving for you and that eventually are going to be effective for us.
Thank you very much. I would like to follow up this with a question to Mr. Bartoloni as a follow-up. What is the role of the health insurance companies in your experience and opinion in enhancing access to care in the United States that we would be able to learn from as well?
Well, the first thing I would offer is that you should not base the quality of your system on what we've done in the West with our systems. We have a lot to do in improving, and we're actually retrofitting our health system to try and arrive at a better place. And it's going to be a difficult task and take a long time. So I would encourage you to continue to pursue the path you're on. And I commend Your Excellency in the Kingdom for putting the individual at the center of the health system. That's the most important thing. And what health insurers do and are doing in the United States now are beginning to take all the data, because we see all the information that happens in the system, and begin to feed that back to the delivery system and facilitate better acts around omissions and commissions of care. But I would argue our measures are still not right yet. And I would caution us all to not just focus on mortality and morbidity as a measure of our success, but to focus on the quality of life of the individual that you have at the center of the system. Living a very long life in infirmity and pain is not a good outcome. It really should be focused on having a high quality of life and finding the optimal level of health for each individual in the population. Not just patients, but everyone in the health system. So I think that's where health insurers can begin to make that change in the United States, and also here is in data systems and capabilities around getting information out to measure the right outcomes for the overall delivery system.
Thank you very much. Do you see a change in the way health insurance companies in the US are changing their direction in how they do business?
We are very quickly changing. Aetna, for example, is the largest health information technology company in the United States today. And most people don't know that. We invest $400 million a year in new application development around mobile technology to empower individuals and providers in the health system to do better in getting to better outcomes. So I think you're starting to see insurers in the United States change their model. The Affordable Care Act in the United States has been an action-forcing event, which is now causing us all to rethink about how we put our focus on the individual, the patient at the center of the system. The United States has not yet made that decision, that we will put the individual at the center of our health system yet. We've yet to arrive at that, and I again commend Your Excellency and the Kingdom for getting there.
Thank you very much. Dr. Rabia, would you like to comment on that? Or?
Don't ask me about the insurance, because insurance companies would be upset with me. But anyway, I have to say it. We have a national social health insurance system in Saudi Arabia that was started several years ago. And I think we started on the wrong path, following, sorry about this, the US model. And we insured 8 million people through the commercial insurance system. And then that was on the expatriates. And then we realized that we are not doing well, and there has been many complaints about the system. Then we have launched a big conference. We have invited the leaders of insurance companies from different parts of the world, including actually the insurance experts from the United States and Canada in particular, plus England, Germany, and many other countries. And in that conference, which lasted for 3 days, the conclusion from all of the experts, including the national experts, that commercial insurance is not the right path to follow, and we should be following a social type of insurance. And the social type of insurance, I must actually clarify, there has been a big confusion that people feel that insurance is health provision, which is wrong. Insurance is health financing and sponsoring. And based on that, this proposal was actually taken to the Cabinet of Ministers, and there has been a resolution that to delay national health insurance for 5 years and to do more workshops and studies and seek expert opinion and adopt the concept of a social type of insurance. I hope that you don't think that I'm talking about the Canadian system, but the Canadian system are following that type of insurance, and I think in Singapore and Korea, so we're studying those systems.
Excellent. Thank you very much. We would like to move on to another important theme in healthcare and businesses, which is training healthcare providers. I would like to direct my question to Dr. Satcher. What would be a successful business model to develop for the fulfillment of the existing gap in the training and professional development of healthcare providers and leaders in healthcare?
Well, first, thank you for the opportunity to participate on this panel, and I want to also join in commending His Excellency, Minister of Health, for his leadership and his presentation. I am a professor of community medicine and family medicine at the Morehouse School of Medicine here in Atlanta. And our mission relates to 3 things that I think are relevant to your questions. One, we're concerned about a system that is top-heavy, and we believe that more focus needs to be put on the training of primary care physicians. I think one of the major weaknesses of our system is the fact that we have such an inadequate supply of primary care providers. I also think that's one of the major challenges in terms of cost containment. A second area that we're concerned about is the area of diversity in healthcare and health provision. Diversity as it relates to race, ethnicity, gender, but also diversity in terms of the makeup of the physician workforce. Thirdly, I think the whole issue of health equity, which you mentioned earlier, is something that I think we struggle with in this country in terms of the training of physicians and nurses and other health professions. So in all three of these areas, I think we need to invest more time and energy, more resources into getting a health system that is more balanced in terms of primary care. The emphasis on health promotion and disease prevention is really critical. I think not just because health promotion and disease prevention is the most cost-effective approach to health care, but because it's also the most humane approach to health care. So I think we need that kind of system. I think obviously the industry is critical because our students and others certainly are aware of the demands out there in terms of health professionals, but also aware of the incentives. And I think the key is, are we incentivizing the kind of professionals that we need and want? In other words, if we are incentivizing volume of care, numbers of visits, as opposed to value in the system and in the interaction with patients, then I think we're going to have a hard time convincing students to go into primary care. On the other hand, if we are incentivizing a system which values primary care and rewards the total care of patients and the balance between health promotion, disease prevention, as well as the treatment of highly specialized problems. Our health system has been outstanding, as you know. Almost half of the Nobel Prizes in medicine have been won by Americans. So we have a lot to be proud of. If one is facing a crisis in his or her health, there is actually no better place in the world to be. The issue that we're struggling with now, and I think with our Affordable Care Act we are addressing, is how do we make sure that everybody has access to our health system and that our health system is balanced in terms of the services that we provide and the incentives that we use to reward care in our system.
Thank you very much. I would like to redirect that question into the experience that we've had probably in Saudi Arabia, and I'm pretty sure in most countries of the world, where physicians eventually elevate to higher levels in the administration, where leadership and management become very critical skills that need to be learned by such physicians. And in order to reshape the healthcare system, you have to have the healthcare background as well as the leadership, management, and business background. Has your institute, is your institute able to create a model for us to adapt in educating our junior physicians and uprising physicians in Saudi Arabia? Is this a model that we can learn from?
Well, I hope so. The Satcher Health Leadership Institute at the Morehouse School of Medicine was actually developed in sort of a response to the Institute of Medicine's report of 1988, in which they said basically the need for leaders in medicine and public health is too critical to leave their emergence to chance alone. So our Leadership Institute focuses on developing physicians and non-physicians who will be in a position to provide leadership in the future. Now, our focus at the Morehouse School of Medicine is heavily in the area of leaders in primary care, but also leaders in the goal of eliminating disparities in health. And that goal was first set for the country when I was Surgeon General in Healthy People 2010, which we released in the year 2000. So that is a goal, and Healthy People 2020 has continued that goal. So we believe that if we're going to achieve that goal, just as we can say if we're going to achieve the goals of the Affordable Care Act, we need a kind of leadership in medicine, but not just in medicine. A recent report from the Institute of Medicine is about the future of nursing. And if there's any area in our country that we have actually underutilized in terms of the scope of practice versus the scope of training, it's in nursing. So we need leadership in our system, and I think we need to do a better job of preparing them. So we have a fellowship program that focuses on health policy, but we also have a community health leadership program in which we identify people who live and work in the community, and they come and they spend 3 months with us, or 1 day a week, really studying how to change health behavior in the community. When I released the Surgeon General's report on overweight and obesity, pointed out that from 1980 to 2000, overweight and obesity had actually tripled among children in this country. We can't solve that problem in the hospital or the clinic. We have to have people leading in the community.
Thank you very much. I would like to ask His Excellency to comment on some of the opportunities, in addition to what you have mentioned in your talk about creating opportunities between the Kingdom of Saudi Arabia and the United States in training in leadership as well.
Thank you, Hanan. There is no question that there are lots of opportunities in training. As I mentioned, the budget of training has tripled in the last 3 years. For training and scholarships. We have many scholarships that we will require for the Ministry of Health and also actually for the health system of Saudi Arabia as a whole. So we are counting on partnership with the leading universities and healthcare systems in the United States to help us train some of our healthcare professionals, not only physicians, but also nursing and administrative staff. Saying that, we already have actually existing programs that we value, and in the area of health administration and also leadership program, the Ministry of Health has already started those programs. We have already existing programs with the Emory University in the public health area with the help of the CDC, and also with the Liverpool School of Public Health in England, and also other universities in Canada. Plus we have a leadership program that we have commissioned with General Electric that already trained a good number of health workers in the Ministry of Health. We have a 5-year plan for the training and scholarship, and we are investing in areas of public health, primary and community medicine, and also leadership programs, plus other health and clinical professions.
Excellent. Thank you very much. Again, a very important topic in the field of healthcare. We will now move along to talk about research, and we have a very distinguished guest with us, Professor Kalou, who has, from my introduction, very well-known researcher with several patents and a leadership in laparoscopic surgery. How does focused research improve the healthcare business?
Well, first, thank you for the opportunity to be here. I was very happy to see that you are committed to investing in research. Research is critical for multiple reasons. First, it ensures that your level of healthcare remains at the top. A fine example of this is my own institution, Johns Hopkins, in which we not only do cutting-edge research, but we're also ranked as one of the best hospitals in the country. And we're able to do that because we are continually seeking true research to advance patient care. So if you want to provide high-level care consistently, not only does it take putting up buildings and training physicians, but also the ability to stay at the top. And to do that, you have to invest in research. Investing in research also allows you to grow jobs. You have students graduating from university who have interest in technology development, and you have a great opportunity for growing jobs. And finally, research in itself lends itself to to generating income. So for example, technology transfer, developing new technologies, new patents, new drugs. If you're successful, you're able to convert this into a way to fund your own healthcare system if you're successful. And at Hopkins, we have a tech transfer office, as many universities do, and these tech transfer offices are driven by the research of the faculty. And this often generates tremendous incomes for the universities. So I think that investing in healthcare research is important for multiple reasons.
Mm-hmm. We would like again to ask His Excellency to reflect on that when it comes to research promotion within the healthcare sector, and what would be the focus of such research?
I totally agree that research is an important and integral part of any healthcare system, and I think it's part of the development of any healthcare system. I must also confess that we have been late in incorporating research in our healthcare system. However, through the initiative driven by His Majesty King Abdullah, research over the last 5 years has been given a lot of attention in universities with emphasis on health research. And I'm sure, Hanan, you know that King Abdullah's initiative for the King Abdullah International Center for Medical Research established in King Saud bin Abdulaziz University for Health Sciences is one of those initiatives. And also in the Ministry of Health, we no longer believe that Ministry of Health is only a health provider, as I mentioned. We believe that research is an integral part of our healthcare system, and that's why in the 5 medical cities, we are embarking on 5 research centers to complement those cities. We are already partnering with the private sector in research and development. We think that research will be an arm for the Ministry of Health, not only to develop healthcare system, but also to be an arm for investment of the future for the Ministry of Health. And we have already started 2 big initiatives that will be launched in the coming few months with research and development and also transfer of technology. We are also negotiating with 2 or 3 firms in that regard. We hope those joint ventures will materialize to improve the research in the healthcare system of Saudi Arabia.
Thank you very much. Back to Dr. Eliana. Again, if you may reflect, the CDC is such an icon internationally, and it's a leadership in its field in healthcare. What, from the presentation of His Excellency and from the mission that we have in Saudi Arabia, what type of collaborations that you think would be fruitful between Saudi Arabia's healthcare system and the CDC?
Interestingly, we've already had some of that collaboration already. You talked a little bit about that in terms of the mass gathering and some of the other work that we've done, so that not only are we available to provide whatever technical assistance we can, but we have learned a significant amount that can be applied not only in your country, but then here in this country and elsewhere. So looking forward to continuing that. I think the area of research is a significant one, in that one of the things that we always say at CDC is that we put our full commitment and weight behind scientific evidence in terms of making decisions about either addressing an issue or investment in a health issue. There are a number of different ways that can be done. It could be done on political basis, even on economic basis, but from a health perspective, we cannot find a more defensible way than using science as a way of determining what the problem is and then how it is that we should address. So collaborating on the science side, I think, is a significant. One of the things that came through in the presentation that, of course, for us is significant, and we talked about it in terms of the insurance sector as well, and that is the importance of surveillance data, the importance of being able to have very good, accurate, timely information about exactly what is happening, who is being affected, where is it happening, in order to, again, be very smart about how it is that we focus those healthcare responses. And in the area of surveillance, the most important development is e-health. And making sure that electronic health records are being developed and used very widely in order to integrate the healthcare system and to integrate the response to healthcare. In that one of the biggest challenges to having a very effective response to healthcare is the time delay between when we detect an issue and when it is that we deploy resources to respond to that. And we think that electronic health records and the widespread use, in fact, the universal use of electronic healthcare records is something that we're looking forward to fix that. So both on the science, the surveillance, and then specifically on the electronic and on the e-health issue, I think are significant areas.
Thank you very much. Would you like to comment, Your Excellency?
Yeah, well, first of all, I value our relation with the CDC, and I think we have more to come, and we are actually eager to even build those relations. Certainly, we would like those relations to emphasize on areas, as you rightly mentioned, of disease control, surveillance. Our Ministry of Health is embarking on a big surveillance system, electronic, taken from the Canadian system, the Panorama system, which we called it Husn, which we are launching actually with, I think next month, if I'm not mistaken. We would like to collaborate with the CDC in that area. We would like actually to learn from you in the disease prevention system. I think this is an area that all of us need to learn from each other. It's not easy to change the behavior of the lifestyle. We are embarking, as you know, in the CDC, on CDC Saudi Arabia. The lab already finished construction based on the recommendations in our prior discussions of biosafety level 4, which will be included. We hope this will be the focus for a regional CDC that we should learn from you together. I think those initiatives, we will be more than happy to get them stronger and learn from you, and we'll be happy also to provide any information that will also help and benefit the healthcare system of the United States.
Excellent. Thank you very much. I think we've accumulated a good number of questions from the audience, so I would like to end the formal panel discussion by allowing each one of our guests to give a 1 or 2 minute wrap-up on providing for the audience that we do not want to lose the touch with our audience, who are a lot of business developers. And if you can just give us a 1 minute wrap-up on what would your advice be on how to enhance the collaboration between the Kingdom of Saudi Arabia and the US in the field of healthcare and business. Your Excellency?
I think that's why you are here. And I think I don't want to repeat my talk, but I want to emphasize that we should actually strengthen our ties both with the public and private sector of the United States in areas related to training. Also, we should look at the opportunities of transfer of technology, medical device transfer technology, pharmaceutical transfer technology. We are also open for the facility development, including the design and construction plans, not to forget the importance of collaborating with the leading healthcare systems in the United States in areas of research that leads to the transfer of both clinical improvement and also economic improvement of the healthcare system. So there are many opportunities.
Thank you very much. Dr. Arias?
I think a wonderful opportunity is to sort of collaborate and partner on how to make the business case for prevention and how to make the business case for health, whether it's, again, on site or for the community. And we're in the process of trying to make a better, or doing a better job of that. However, we recognize that we have significantly more to go. So coming up with a way of sort of educating businesses. And I think, and our experience has been that once a company, a corporation is aware of what it is that we have to offer, what the possible return on that investment is, then it's sort of, you know, uphill from there, and sort of a very significant and strong partnership. One of the things that I want to share and sort of offer to talk about a little bit more is, as a government agency, there's certain things that we cannot do. There's certain things that we even cannot partner with businesses or others for. One of the things that we've done in order to sort of broker that relationship between the federal sector and then the private sector is the creation of a foundation. So we have a CDC foundation that is in a position to essentially partner very directly with businesses to help them achieve a health outcome that they would like, that we then can provide technical assistance for, but we couldn't receive monies, for example, to do a particular project. So the sort of considering the possibility of setting something similar, I think makes it very easy for then the private sector, specifically business, to partner with government, and then also for government to partner with them. So having that mediating body is something good to continue to explore.
Excellent. Thank you very much. Mr. Bartoloni.
Yes, being a business person myself, I would make this comment. I think the best way to build a relationship is to solve real near-term problems as soon as you can, to build momentum. So I think having an idea of where we want to head in the longer term is very important, but getting at very specific issues. And I would point out one in the kingdom is obesity and the impact of diabetes on the population. Aetna takes care of all of the students from the cultural mission and their dependents throughout the world. Their obesity, their diabetic rate is 3 times that of the normal population in the United States of students at the same age. And we've been working very specifically on that issue to impact costs over time. So I think programs focused on very specific, tangible efforts right away build a relationship that over time can expand to broader and the greater ideal in the long run. So I think that's the best way to get a relationship started.
Thank you very much. Dr. Satri.
Well, I think it's really critical to, when you look at the United States, to look at not just where we've been, but where we're trying to go. And I think the Affordable Care Act is a real attempt to move us in a direction that would do a few things. Number one, it would make our healthcare system more cost effective. It would improve the quality, and I think a few days ago, Dr. Don Burrick, leaving his position as head of the Center for Medicaid and Medicare Services, pointed out that he would estimate that we waste 20 to 25% of our expenditures in our health services because of a lack of coordination, because of duplication, and because of waste. We can do better than that, and we are going to do better. And I think as we partner with others, we're going to partner on the basis of where we're going. Also in the Affordable Care Act, the new emphasis on preventive services, even giving older people the opportunity to come in for a complete physical exam and workup yearly, and I understand that 2.5 million people have taken advantage of that this year. So I think in partnering in the future, in addition to the comments that were made about research, and I think really critical, we are trying to move in a direction, number one, in which everybody has access to quality health care. We have a balanced system of care, and we provide the right incentives.
Thank you very much. Professor Kalu?
I think the opportunity is to really partner with the United States to develop a research infrastructure. As Dr. Sackett mentioned, that the United States have more Nobel Prize winners in medicine than any other country. If you're able to develop a research infrastructure, you encourage innovation. Innovation leads to development of intellectual property, and both in the pharmaceutical and the technical aspect. And this innovation will lead to patents that can drive business and drive income. So I think the other advantage, of course, in research is the improvement of health, keeping at the cutting edge of the uppermost level of healthcare. And so I think there are two dual benefits in investing in research, and research itself can pay for itself by technology development.
Thank you very much. I think we have about maybe 5 more minutes left before we will give a break for our transition. So I'll take maybe 2 questions. This is a question to His Excellency Dr. Rabia. What is the role of the private sector in the e-health initiative of the Ministry of Health?
As I mentioned in my presentation, we have an ambitious e-health plan for Saudi Arabia. We already have, we know what you want to do. We have the vision, we have the strategy. It has been public, our strategic plan. And it is investment of money, as mentioned by my friend Abdullah Zainal, that we have close to 3 to 4 billion US dollars in that area of to be invested. I see that there is a good chance for collaborating with we cannot actually do it without the private sector. There are opportunities in different aspects of e-health, be it the HIS system, be it the PAC system, or be it with the surveillance system that has been mentioned, or with the patient satisfaction or the patient referral systems. Some of the systems will be actually the fairest to be built for Saudi Arabia, and also they should be partnerships. They could be a model to be followed. Our patient referral system, which we are already partnering with the private sector, we feel that if it succeeds, it will be a model to be followed in different parts of the world. So there are many opportunities. I will advise the e-health business investors to look at our strategic plan, and we will be more than happy to look at it, not only from just implementing the system, but being partner with us for us to implement it. And our vision for the future, that we will partner for them to implement it in the private sector of Saudi Arabia and also implement it in the region. So I think once they take, that has been taken by the Ministry of Health of Saudi Arabia, many countries in the region are watching what we do, and they will implement it. So we will not be a public partner, but we will be a private partner with them.
Excellent. Thank you very much. Another question, again, for His Excellency. What are the opportunities for construction and engineering? Again, I'm trying to select the questions that deal with partnership and businesses.
I think I'm not aware of any country where the Ministry of Health is building 190 hospitals. I'm talking about big hospitals, and 5 medical cities. If you know, let me know. And 1,400 primary healthcare centers. This is an investment worth of $15 billion that we are investing in the coming 5 years. So I think there are opportunities for the design firms, the construction firms, to partner with Saudi Arabia. We want to learn from it also. We want it to be a model to be followed. I think we should learn from the experience of the design and construction plans that has been adopted by hospitals in the US and different parts of the world. And we have to be unique. And maybe those models, we will share them together, and they will be also open for the future to be used by different healthcare systems of the world. Looking at the business, also we will look at it from a business point of view, that those designs, once we own them, we will partner to sell them to those who are interested, and that will be an income for both our partner from the private sector and an income from the Ministry of Health. I have to also wear the hat of businessman tonight.
Thank you very much. I think we'll have one last question to Dr. Ilyana. It was a question regarding the U.S. strategy for reducing and prevention of chronic conditions, specifically diabetes and obesity.
As most of you know, not only, it was mentioned not only for you, but for us, it's a significant issue, and it's a leading cause of illness and death in the United States for Americans across the lifespan, for children and adults as well. So we have, at the CDC, we have 6 priorities, which we call winnable battles. They're winnable. We know what can be done in order to make a significant difference. However, it is difficult, and therefore they are battles, and it's going to take a long time before we actually are effective. And nutrition generally, which includes obesity and then includes food safety as well, is one of those. The strategy essentially is to, again, as I mentioned, identify all those. We've been working at this for a while, and it has not been as successful as we've wanted. We have made some significant strides, especially among kids, mostly because of the changes that have taken place in the policy realm that has changed the context and accessibility to healthy foods among kids. So we are starting to see a small decline, or at least a flattening of the rate of increase in obesity among children. We're not seeing that among adults, and we have to do a better job. Again, we have to identify everybody who's in a position to be able to make an effect in that area. Policymakers certainly have to be very careful about the decisions that they make to make sure that the healthy choice for families is the obvious choice, it's the easy choice so that they can deal with the obesity issue. We're working with schools, we're working with the private sector. We're, again, identifying everybody who we can identify in that. One of the things sort of related to diabetes, one of the initiatives that we have launched recently, and although CDC and the Centers for Medicaid and Medicare Services is taking the lead in terms of coordinating the effort, it is a department-wide effort. It is a federal effort, and that's the Million Hearts Initiative, where we have said that we know what can be done so that in the next 5 years, we can prevent 1 million heart attacks and 1 million strokes in this country. And essentially, it has to do with working with the healthcare delivery sector to make sure that the prevention effort is being done correctly, both to be successful at the primary and secondary prevention of cardiovascular disease and strokes. And essentially, it simply means making sure that people who are at high risk, for example, for a heart attack are taking aspirin in the way that they should. That's not happening now. It also means making sure that people are being screened and then treated appropriately for high blood pressure and cholesterol issues, and then, of course, the smoking cessation. So that's one where we've included both government and the private sector broadly in a partnership to make sure that the healthcare sector is helping us in the prevention area and addressing the issues in a way that the science tells us needs to be addressed in order to make sure that we have a significant impact.
It's a huge task for all of the healthcare providers, I guess, around the world. And I would like to conclude by, again, thanking you all for your presence and thanking our distinguished panel guests. Thank you very much.